Yes, good evening, everyone, and welcome to our webinar. A happy heart is a healthy heart. We are so glad you could join us this evening. My name is Katie. I'll be your host, and I will introduce our speaker, Teresa, in just one moment. Should you have any technical difficulties, there's a number at the bottom of the screen to call. There's a 1-800 number. Um, let's see if you could go back one screen, Teresa. So sorry. Here's the 1-800 number. Call Log Me In Support at 800-263-6317. All right, our format includes a short presentation followed by an interactive discussion. To type in a question, just use the questions section of your webinar toolbar. You'll see that toolbar to the right-hand side of your screen. You can drag it around and move it out of the way if it's in your view of some of the slides. So at the end, you'll have a chance to ask questions. So we look forward to an interactive webinar. So just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, but please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Educators will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Educators. So our webinar leader this evening is Teresa Grasso. Teresa is a registered dietitian and certified diabetes care and education specialist. She's been working in the nutrition field for over 20 years and has specialized in diabetes care for the last 10. She resides in New Jersey with her husband and 3 daughters. She leads an active life with her family as they are involved in multiple sports and activities. Teresa is passionate about nutrition and leading a healthy lifestyle and enjoys teaching others how to improve their health. So, thank you so much, Teresa, for joining us this evening and sharing your expertise with us. So, you may take it away.
Thank you, Katie. So welcome everybody. So our agenda this evening, our discussion will include a little bit about cardiovascular disease or CVD, CVD risk factors, why people with diabetes are an increased risk for CVD, steps to take to prevent cardiovascular disease. We'll also supply you with some resources that are, really great, and we'll have some question and answers and sharing some more information. And just again, please talk to your healthcare provider before making any changes to your diabetes treatment plan. So a little bit about cardiovascular disease and what it is. So CVD or heart disease is basically when plaque can build up in our arterial walls. So this narrows our arteries and it's going to be harder for the blood to flow through. So you can see in that picture there, a diseased artery has that plaque, all against the walls, and it just gets narrower. Blood clots can form, and these blood clots may stop the flow, causing a heart attack or a stroke. So a heart attack, we do have some warning signs. The heart attack occurs when blood flow to part of the heart is blocked by a clot. And most people will survive their first heart attack, but will need to make changes. Working with their doctor, medications will probably be prescribed, and definitely lifestyle changes, which we'll get into a little more. But some of the warning signs may have discomfort in center of the chest that lasts a few minutes or that goes away and comes back. Discomfort in other areas of the upper body, arms, back, neck, jaw, stomach, shortness of breath, and breaking into a cold sweat and some nausea. So again, with that picture, you can see that plaque is blocking the arteries. Okay. Stroke is something else that can happen, and a stroke would be sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking, or difficulty understanding speech. Could be sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance, or lack of coordination, and sudden severe headache with no cause. There's a couple different types of stroke, and an ischemic stroke, which is the most common, happens when a blood vessel that feeds the brain gets blocked, usually from a blood clot. When blood supply to the brain is shut off, brain cells will die. The result is inability to carry out some previous function. So ischemic attack can affect walking, talking, some of the everyday things that we need to do. A hemorrhagic stroke occurs when the blood vessel within the brain bursts. So again, you can look at those different pictures there, and most likely cause of stroke can be high blood pressure. And a stroke does have some things you want to think about. If somebody's having a stroke, we use the acronym FAST. So if you think someone may be having a stroke, act fast. And you do these simple tests. So F would be for face, and we ask the person to smile. Does one side of the face droop? A would be for arms. We would ask the person to raise both arms. Does one arm drift downward? S would be for speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? And T would be for time. If you observe any of these signs, you want to act quickly and call 911 immediately. So this is a great acronym to remember. Anybody is experience a stroke, you want to act fast and have the person do some of these things here, and you can see if they're having any issues and to call 911. Okay, so some other sides of types of cardiovascular disease, heart failure. So heart failure doesn't mean that the heart stops. Sometimes this is called CHS or congestive heart failure. And what it's telling us is the heart isn't pumping blood as well as it should. The body's need for blood and oxygen is not met. Another cardiovascular disease could be arrhythmia. So arrhythmia is abnormal rhythm of the heart. So arrhythmia could be the heart is beating too fast, and that's called tachycardia. And it could also be the heart's beating too slow, bradycardia. But basically the heartbeat is irregular, and this is, an issue which is a cardiovascular disease and something that you'd work with your doctor on there. And there can also be heart valve problem. So the heart valves are not opening and closing properly. So when the heart doesn't open and close as it should to allow the blood flow to flow through as it should, there's regurgitation happens and some leaks, and sometimes we hear called like mitral valve prolapse and stenosis and things like that with the heart valve problems. So these are just other types of cardiovascular disease. So what we're looking at is that cardiovascular disease and diabetes. So the statistics speak pretty loud and clear that there's a strong correlation between the two. So if you are somebody who has diabetes, we have to just be aware of the heart disease and the cardiovascular disease and work with some of our prevention methods to make sure, we're staying on top of these things and knowing some of the signs. So at least 68% of people age 65 or older with diabetes die from some form of heart disease, and 16% die of a stroke. So you can see those statistics are pretty large and scary. So we want to make sure that prevention is what we're looking at. Adults with diabetes are 4 times more likely to have heart disease or stroke than adults without diabetes. And the American Heart Association considers diabetes to be one of the 7 major controllable risk factors for cardiovascular disease. So again, we'll talk about that a little more, but we want to make sure our diabetes is under control, because if our diabetes is under control, our risk of heart disease will go down, and that's what we're looking for. Okay, so there's some, risk factors that we can change and some that we can't. So we want to look at some of the things that we can do. Why people with diabetes are at higher risk, we know that. So what are some things that we can change to help lower our risk? So we'll talk more about that. But oftentimes people with diabetes can also have high blood pressure, and that increases our risk. Abnormal cholesterol levels and high triglyceride levels. So when we look at our cholesterol, the LDL cholesterol is that bad cholesterol or that unhealthy cholesterol. So if that's high, that's another risk factor. If our good cholesterol, that healthy cholesterol, the HDL, if that's too low, that's another risk factor. So those are things we want to look at. Obesity, somebody who's overweight has insulin resistance, and that's an increased risk factor. Somebody who doesn't exercise, so lack of physical activity, and increased inflammation. So like I said, some of these things are things that we can kind of work on lowering. We can practice a healthier diet, which we'll talk about more, and that can help lower our risk. Okay, so what exactly can we do to lower our risk? We can lower our blood pressure. We can work on losing weight. We can try to exercise more. We can manage our diabetes, and we can quit smoking. So if we smoke, in addition to having some of these health conditions, that can really raise our risk. So, quitting smoking would be something that we kind of put on the top there, because again, that's something that we can control, right? Not saying that it's easy by any means, but we can work with our doctor with smoking cessation programs, and most states have really great smoking cessation programs. So if you're a smoker, you can go on, and wherever you live, New York, quit smoking, New Jersey, quit smoking, Kentucky, quit smoking, or wherever you live, go ahead and Google that, and you will get some really, really great resources to help you out. Okay, so that big one on the list was blood pressure. So we know high blood pressure doubles our risk of stroke if it's uncontrolled. So one of the best things we can do is monitor our blood pressure, right? If we have high blood pressure, we need to make sure we're checking it. So we don't always feel blood pressure. It's, why heart disease is often called the silent killer or high blood pressure, because it's not necessarily something that we feel. So checking it would be super important. We want to maintain blood pressure of less than 140 over 90. So we know ideal blood pressure is 120 over 80. You have to remember blood pressure fluctuates. It's not going to be the same every single day, every single time you check it, but we're looking for that 120 over 80, and definitely in the range of no higher than 140 over 90. So if you're checking, it's a good idea to check it, same time every day, or maybe some morning, night, or whatever your doctor recommends. Make sure you're seated, your arm is at heart level. So we would always rest our arm on a table. We'd want to relax a little bit. We want to put that blood pressure cuff around our upper arm. Most of our blood pressure cuffs that we use at home kind of look like this one here in the picture, but you would sit, feet on the floor, relaxed, arm chest level, resting on it, arm resting on a table, and go ahead and check that blood pressure and record them. Keeping a record of your blood pressure to see if there's any trends, it is really good, and that's great to show your doctor. So in between your doctor's visits, checking that blood pressure and having that log to show your doctor doctor is super important because they're only checking it that one time you go into the office and getting an idea of what your blood pressure it is. But if you can kind of have that log that really shows maybe the ups and the downs or where your trends are, that's really helpful to, adjust certain things like medication and diet and stuff like that. So speaking of diet, we want to watch our salt. So we know salt is something that can raise our blood pressure levels. So when we have high blood pressure, we're trying to limit our salt to 1,500 milligrams a day. So that's about a half a teaspoon of salt. So what I would recommend is, remove the salt shaker, because once we start sprinkling salt on our food, that can really contribute to a high salt level that we're eating. And then you want to watch processed foods. The biggest processed foods, deli meats, processed meats like hot dogs, salami, canned foods, canned soups, eating out. Those are, some of our highest things. And our food label is also really our friend when we're talking about sodium levels. So when you look on a food label, you want to check for low sodium foods, no added salt. Those are good, like kind of trigger words that you can see if something's going to be low in salt. You also want to look at portion sizes that you're eating. So the food label, always look at the serving size and then look and see how much sodiums are in a food. So you want to know that serving, how much they're talking about, and then how much sodium is in each serving of what you're about to eat. A good rule of thumb is anything over 300 milligrams per serving. Kind of look at that and question it and see, like, okay, if this says serving size 1 cup and I eat, 1 cup, I get 300. But if I double that serving and I eat 2 cups, now I'm getting 600 milligrams. So you want to be really careful of how that sodium can add up. If something says low sodium, that would mean it's 140 milligrams or less per serving. So those are just some key things to look at on a label. Another really great thing is making sure you get fruits and vegetables. Particularly, we want 4 to 5 cups per day. So maybe that might look like having 2 to 3 pieces of fruit in the day and, making sure we're having a couple cups of vegetables each day, lunch, dinner, snacks, making sure you're getting those in. Our fruits and our vegetables are filled with lots of vitamins and minerals, potassium, magnesium, things that really can help keep our blood pressure at bay. So making sure we have these great whole foods in our diet is super important. The exercise piece is also important. Getting at least 30 minutes of moderate to vigorous exercise at least 5 days a week. So about 150 minutes per week is recommended, particularly by the American Heart Association. So it might sound like a lot when we think like, oh, 150 minutes, but you can break that up to that 30 minutes a day. And it doesn't have to be all at once, depending on your exercise level. Maybe you're able to do 15 minutes in the morning walk and another 15 at night. Maybe you just start with 10 minutes and you try to do 10 minutes 3 times in the day. So you can break it up, but the bottom line is we need to make sure our body is moving. Quitting smoking, so we did talk about that already. And then taking medication. So if your doctor prescribes you a blood pressure medication, it's super important to take that. We want to make sure we're not skipping our medications. You want to make sure you're taking them as prescribed. If you're having any side effects or it's not agreeing with you, make sure you discuss that with the doctor. You just don't want to discontinue these medications on your own. You want to continue to take it as prescribed. Obesity, so we know that is a risk factor. Complications are with obesity. You can have high blood pressure, diabetes, and being obese with these conditions raise your chances of having a stroke. So losing as little as 10 pounds, or if you look at your weight, starting with 5% weight loss. So 5% weight loss can really help lower your risk. So, that's something that's often looked at, 5 to 10% can help lower blood pressure levels, lower cholesterol levels, lower our diabetes blood sugar numbers. So a lot of times if we think of if we're overweight or we're obese and we think of the amount of weight we want to lose or need to lose, or maybe we're looking at the BMI chart and it says you need to lose a lot of weight, that can be super overwhelming. So if you try to chip that weight away, right, if we can say 5%, so someone who's 200 pounds, if we say 5%, that would be that 10 pounds. So just working on one little goal at a time. I can work on losing that 10 pounds. And then once I get there, maybe I'm feeling good and I'm on a roll. And maybe I can say, okay, I'm going to try to lose another 10%. So now I'm going to aim to lose another, 8 pounds or whatever it might be. But try to think of it like that. Don't overwhelm yourself with a large amount of weight you may need to lose. We look to keep our body mass index down at 25 or less to be in a healthy range. But a good idea is if you are looking at that BMI scale, just moving down. If you see your BMI and you go by your height and your weight and you're looking at a chart and it says your BMI is, let's say, 34, if you work on losing that 5 to 10% and now your BMI is a 30, you've made progress, right? And now you can go from 30 and then keep working on it and then slowly bring that BMI down to where you can feel healthier and improve these numbers, blood pressure, cholesterol, all those things. A really great idea is to work with a registered dietitian who can really help you with your weight loss goals. You can find dietitians in your area at www.eatright.org. So that's somewhere you look for dietitians in your area, or also get really great nutrition information. And we talked a little bit about exercise on our previous slide, helping our blood pressure, but that can also help us with losing weight, right? So making activity part of your everyday. So just think about moving more. We know we want to get that exercise in, but we also want to think about moving more. How can I get more movement in throughout the day? If you find yourself sitting, whether you're working at a desk or maybe you're watching TV, if couple hours have passed, maybe you just get up and take 5 minutes to walk around. If you're home, you're walking around in your house. If you're out, or if you're at work, maybe you're, walking around in the office or just taking the stairs up a flight and walking down. If it's nice out, maybe you're walking around the block, little things like parking our car a little further, so we're getting in some extra steps. All these little things you can do throughout the day add up, and they are going to add up for your benefit. Okay. Our blood sugar management. So we really want to work to make sure our blood sugars are under control and our diabetes is under control. Because if our diabetes is chronically high, that's damaging blood vessels, and that could make blood clots form more likely, which puts us at higher risk of that CVD. So we want to make sure we're monitoring our blood sugars. So normally we have our blood sugar meter at home, and we would just see what our doctor says, checking those blood sugars each day, keeping a log of those. It's always good to oftentimes vary. We try to check fasting in the morning is a great time to check our blood sugar. We look for that fasting blood sugar to be between 80 and 130. And another good time to check is 2 hours after you've eaten something. So 2 hours after we've eaten or 2 hours after a meal, we check our blood sugar and we look for it to be between 80 and 180. So we're trying to keep that blood pressure after a meal no higher than 180. So 2 hours after, no higher than 180, fasting between 80 and 130. So again, good to check. Keep that log. If you're seeing any trends at certain times of the day, it's not in the range that you want it to be, you're going to, discuss that with your doctor and see if any adjustments need to be made. So to control the blood sugar, we're always going to look at our diet, right? So, we know we're looking at carbohydrates in our diet. We're looking at the portions of those, making sure we're eating our meals, appropriately timed meals and portioned meals. That's going to be helpful in controlling our blood sugars. We're looking at getting that exercise. So I know we talked about that a couple times, but keeping our body moving and having activity each day helps our blood sugars. And then again, medications. So if we're prescribed medications to control our blood sugar, we want to make sure we're taking them as prescribed. Okay, and the smoking, I know we spoke about this a little bit, but what does it do? It can accelerate clot formation. I mentioned you can look at smoking cessation programs in your state. You can also check with your doctor, right? Your healthcare provider, to give you some more information on quitting. There's different aids such as nicotine pills and patches and counseling and medication. So, you can explore the different things with your physician and see what's going to be best for you. A lot of times, like I said, it's not easy. And sometimes it takes several times of quitting. You're trying to quit to be successful at it. So, don't beat yourself up if you've tried and you haven't been able to quit in the past. There's no better time to try again, right? And really try to beat that habit. Okay, so here are some really great resources, and I'll leave this up for a couple minutes. The American Heart Association, so their website is heart.org. Really great website to get lots of great information. If you want to learn more about blood pressure, you can, type in blood pressure. You can, get some great nutrition information, and they also have a recipe section where you can get great recipes, low sodium and really good heart healthy recipes. They also have a lot of resources on there, like handouts, things that really can help connect what you need to do to help with lowering blood pressure and heart disease risk. One of the handouts I really like on there is called the Salty Six. So it kind of goes over the highest salty foods in the American diet. And, a lot of them are some things we mentioned before, like cold cuts, sandwiches. If we're ordering out a deli sandwich, just the amount of meats and things on there make high salt meats, and then we're putting so many pieces on there, you're getting a lot of salt. Pizza, so we might not think of pizza as being tasting salty, but it does have a lot of salt in it. Soups, canned soups are eating out. Burritos and tacos rank up there as one of our high salt foods, and bread and rolls. So again, like a piece of bread, we might not think it tastes salty, but if you look at a food label and it's processed, you can really see how much salt is in that. So just some really great handouts and information on that website, and then along with some of the other ones here. So American Diabetes Association, diabetes.org is really great too, to give you, great concrete information to help you with your diabetes management. And again, it has some really great recipes and hands-on things that can be real helpful for you when you're, looking to eat healthier and have a healthier lifestyle. Okay, so we do have some time for some questions and answers. So let me see if anybody has put anything in the chat, or you can go ahead and, add some questions right now. Okay, so go ahead and put any questions in there if you can. So one of the things I see is somebody asking if eggs are bad for you. So this is a food that often kind of goes back and forth, right? We know that eggs are high in cholesterol. So we want to be careful. If we have high cholesterol, we think like, oh, I shouldn't be eating something that has a lot of cholesterol in it. There's been a bunch of studies done that look at eggs, and yes, they are a high cholesterol food. One egg is close to, 200 milligrams of cholesterol, which really is how much we should be eating in a day. Um, but people who eat eggs, that's not generally what makes someone's cholesterol go up. Eggs have a lot of great things in them, B12, vitamin D, choline. So they have a lot of great health benefits. They're also a great protein source. What we have to look at is oftentimes, what does someone eat with eggs, right? Eggs may be served with bacon and sausage, and maybe we're having it on pork roll, egg and cheese sandwich. So eating them with higher fat foods, which can those are the things that can raise our cholesterol too. Um, and then, just thinking of, what else is going on. So it's not just the eggs alone. Eggs are certainly a whole healthy food to eat. American Heart Association recommendations is, you certainly can have up to 1 egg a day. But we just want to be careful of, what am I eating those with? Because a lot of times that is the real issue, what these foods are paired with. Okay. Okay. And then somebody's asking about HDL cholesterol and the good cholesterol, and what are some ways to help raise that cholesterol? So that's a great question, because we know that good cholesterol, the HDL, is the type of cholesterol that's protective. It has a lot of heart protection. So we want our HDL to be high, and we're looking for that bad, the LDL cholesterol to be low. So to kind of work on that, weight loss is something that can help that HDL level come up. Exercise is something that can help the HDL level come up. And then also making sure we have omega-3 fats in our diet. So omega-3 fats are healthy fats, and they're found in things such as salmon and mackerel and tuna and sardines. So that would be some of the protein sources that have omega-3. They're also found in some plant-based products, such as flaxseed, chia seeds, and also in nuts like walnuts. You can even get eggs that are high omega-3 eggs. So a way to raise that HDL cholesterol is getting some of these healthy fats in your diet, these omega-3 healthy fats, and that could help with your good cholesterol raising. So that's a great question. And, those are good foods to include in your diet, those high omega-3 fatty foods. Like I said, also weight reduction, and then quitting smoking. That's another thing that's, helpful in many ways, but it can also help get that good cholesterol up a bit. Okay, and if you have any other questions, like I said, just feel free to jot them down in the chat. Okay, and we did talk a little bit about those fats. So saturated fat is, we were talking about the good fats, the omega-3s and monounsaturated, but saturated fat and trans fat. So somebody was asking, what is the trans fat? So we know saturated fats are something that can raise our cholesterol and aren't good for our heart. So those would be in whole, like dairy products, so whole milk, or whole cheeses made with whole milk products, high fat meats. So if you're thinking that salami and hot dogs and red meat with lots of like marbled fat in it, those are things that have that saturated fat. Butter, um, and then trans fats are more of like a man-made fat. So if you kind of think about some foods that have an increased shelf life, trans fats help it have an increased shelf life. So like maybe like cookies or like some baked products that you can buy on the shelves, cake products and things like that. Trans fats are like a liquid fat. If you think of like a vegetable oil that's made into a solid. So think of like a vegetable oil that goes into a margarine. So it's a liquid that's made into this like solid, and that creates these trans fats. So even though it is a vegetable product, so like the vegetable oil doesn't have cholesterol. Cholesterol is only in animal foods. Vegetable oils are not going to be high in saturated fat. But now that we made it into the solid form, like a margarine, it created these trans fats, and these trans fats act like these saturated fats in our body and can work to increase cholesterol levels and things like that we're not wanting. So we want to be real careful at the types of fats in our diet. We definitely need fat in our diet, but we want to try to think of those healthy fats, those omega-3s, using things like olive oil, and nuts have some healthy fat in them. So there's ways to get healthy fats, avocados, as opposed to using these high saturated or trans fat products. Okay, oops, I see one question here. Oops. Sometimes it's a little hard to say. So are both types of stroke caused by strokes caused by clots? Let me think about that. It's generally a blood clot where, either the blood supply to the brain is kind of shut off. The hemorrhagic stroke is more when a blood vessel bursts. So I don't know that I would necessarily call that one. Let me see if I could go back to that slide. That one a blood clot. So we can kind of look at that picture if that helps you. Okay, so if you look at the two different types of stroke, so the hemorrhagic is more of like the vessel wall ruptures and there's bleeding in the brain. And then the ischemic one is more where there's an obstruction. So more of that reducing the blood flow or blood clot. So yes, they're both similar in that, they're having this area in the brain that there is something going on, bleeding or cut off in the blood supply. But they're a little bit different in that sense. So I hope that answered your question. But you can always talk to your doctor more about that too, if that's something you're concerned about, or you have some of these risk factors that you're, looking at to avoid stroke. Okay, just getting back to our, okay, let me see if there's any more questions. Okay, so it doesn't look like there's any more questions. So thank you everybody for joining tonight. I hope you learned a little bit or reinforced some stuff you already know. I don't know what my computer's doing. Okay, here we go. But I did want to let you know about some of our upcoming live events. So we tend to have one of these webinars once a month. And so if you're interested in any of these upcoming live events, let your diabetes coach know. They can schedule you. You can also go on our website and you can, see all the upcoming ones. We have on October 17th, also at 6 p.m., Diabetes 101. So that's mastering the essentials. And then on November 13th, we have that one at 5 p.m., so a little different time. And that one's embracing the holidays without deprivation, healthy eating strategies for every festive eater. So just a lot of great holiday eating tips, because we know in fall into winter, we have a lot of those holidays coming up. So it's really great to, help stay on track with that. And that one will be in both English and Spanish. So definitely try to sign up for those. So if you want to attend more of our events, ask your clinician that you're working with, reply to one of the emails we sent. So you'll always, you'll be able to apply through those emails. If you want to receive text message reminders, you can always ask your clinician to make sure you're signed up for those. And we do have our diabetes page. So for a lot of great diabetes information, make sure you like us on Facebook, facebook.com/ Cecilia Health, and you can always get information on there. And of course, our website, ceciliahealth.com. We have a really great blog. Several articles come out each month, so those are really great to read and give you some good information too. So thanks so much for joining us today. We appreciate your attendance and participation. So I hope everybody has a wonderful evening. And if you have any other questions, make sure you ask your coach about those, okay? Take care.